Welcome, medical students, to today's microbiology lecture. Today, we will delve into the fascinating world of gastrointestinal infections and explore a wide range of topics that encompass the clinical manifestations, diagnosis, treatment options, and prevention strategies. Clostridium difficile infection is primarily characterized by diarrhea and abdominal pain, commonly associated with antibiotic use. Toxins A and B damage the colon, leading to inflammation. Diagnosis includes detecting toxins in stool samples, while treatment involves metronidazole, vancomycin, fidaxomicin, or fecal microbiota transplantation. Helicobacter pylori is a bacterial pathogen responsible for chronic gastritis, peptic ulcers, and gastric cancer. The emergence of antibiotic resistance in H. pylori strains has posed significant challenges to eradication efforts. Resistance mechanisms include genetic mutations in bacterial targets, such as the 23S gene for clarithromycin and the GIRA gene for fluoroquinolones. Global prevalence studies indicate a high degree of resistance to commonly used antibiotics, such as clarithromycin and metronidazole. This resistance has a substantial impact on treatment success rates and requires tailored therapeutic regimens based on regional resistance patterns. These molecular techniques overcome the limitations of traditional culture methods for diagnosing gastrointestinal infections. PCR, multiplex PCR, and NGS enable the sensitive and specific detection and characterization of pathogens, including multiple pathogens in one reaction and the identification of novel or emerging pathogens. Bacterial biofilms in gastrointestinal infections are structured communities of bacteria encased in a self-produced matrix. They provide protection and resistance to treatment. Biofilm formation, composition, and regulation are complex processes. Disrupting biofilms and improving treatment effectiveness are ongoing challenges. Toxoplasma gondii is a protozoan parasite that can infect various warm-blooded animals, including humans. While toxoplasma infection is often asymptomatic, it can have significant effects on the host's behavior. The parasite manipulates neurotransmitter signaling, particularly dopamine, leading to alterations in cognitive function and behavioral changes. Studies have suggested a possible link between toxoplasma infection and psychiatric disorders, such as schizophrenia and bipolar disorder. However, the precise mechanisms behind these associations remain unclear and require further investigation. Understanding the effects of toxoplasma infection on the host's brain and behavior is essential for developing potential therapeutic interventions. By manipulating the gut microbiota, either through probiotic interventions or fecal microbiota transplantation, it is possible to restore microbial balance and improve the outcomes of gastrointestinal infections. These emerging strategies show promise in the field of infection management. In summary, viral gastrointestinal pathogens have evolved strategies to evade the immune system, establish persistent infections, and cause chronic diseases. Understanding these mechanisms is key to developing effective antiviral therapies and vaccines targeted at viral proteins involved in replication cycles. Antibiotic-associated diarrhea is a common complication of antibiotic therapy. Disruption of the gut microbiota allows Clostridium difficile to overgrow, leading to diarrhea and inflammation. Minimizing unnecessary antibiotic use and developing strategies to selectively target pathogens are important in managing this complication. Waterborne gastrointestinal infections pose a significant public health threat worldwide. Pathogens such as Escherichia coli, Cryptosporidium, and norovirus can contaminate water sources, leading to outbreaks of diarrheal illness. Detecting waterborne pathogens requires sensitive and reliable methods such as PCR, immunological assays, or microbial culture techniques. These methods enable the identification and quantification of specific pathogens to assess water quality and guide appropriate interventions. Public health interventions for ensuring safe drinking water include source protection, treatment technologies, and monitoring systems. However, climate change has the potential to affect water quality, with increased flooding and extreme weather events contributing to contamination risks. Foodborne parasitic infections pose significant public health concerns, especially as emerging parasites become increasingly recognized. Parasites such as Cyclospora and Cryptosporidium have caused outbreaks associated with contaminated fruits, vegetables, and water sources. Various risk factors contribute to food contamination, including poor agricultural practices, inadequate sanitation, and contaminated irrigation water. Stringent food safety regulations and measures to ensure the proper handling, storage, and processing of food products play crucial roles in preventing parasitic infections. Detecting parasites in food samples can be challenging due to their low abundance. Techniques such as microscopy, PCR, and immunological assays enable the identification and quantification of parasites, improving surveillance and control measures. Fungal infections of the gastrointestinal tract, especially Candida species, are challenging in immunocompromised patients. Molecular techniques help diagnose specific species and detect resistance markers, informing treatment with azoles, echinocandins, or polyens based on patient factors and resistance patterns. Gut microbiome manipulation through probiotics and prebiotics is effective in managing gastrointestinal infections. Synbiotics, a combination of probiotics and prebiotics, enhance their effects. Fecal microbiota transplantation is successful in treating recurrent C. difficile infection. Based on the complexity, terminology and details appropriate for a medical student audience, gastrointestinal infections are a complex system with various clinical manifestations, treatment options, gut microbiota dynamics, and environmental factors impacting transmission. Proper understanding is crucial for prevention, diagnosis, and treatment.